Hello everyone, my name is Sundas Bibi and today I'm going to discuss one of the topic related to module developing values and principles in health and social care setting. The module code is 4043 and today we are going to discuss the standard 9 and that is one of the lecture, and this is a standard 9 of case certificates and which is related to awareness of mental health, dementia and learning disabilities. So in today's session, we are going to discuss and understand the experiences of people with mental health needs, dementia, and learning disabilities. We will understand the importance of promoting positive health and well-being for an individual who may have mental health needs, dementia, or learning disabilities. We will also understand the adaptation in care delivery related to an individual who is suffering from these issues, and we will discuss what are the signs and symptoms and of these mental health issues and how we can support them. Um, if you talk about the awareness of mental health, dementia, and learning disabilities, or role as a health and social care workers, may not include providing a direct support to the individuals with the mental health problems, dementia, and learning disabilities, but having an awareness of these. You can say diseases or disorders. It will help us to identify any early signs and symptoms, as well as it will enable us to work in a ways that show compassion and understanding. So it is really very important to know the dementia, types of dementia, what are the different mental health problems and different types of learning disabilities, and how as a health and social care worker we can support these people having these issues. If we talk about mental health issues statistics, then 1 in 4 people will experience a mental health problem of some kind each year in England. 1 in 6 people report experiencing a common type of mental health problem, for example, anxiety and dementia, according to one of the survey which was done in 2023. And now we will discuss mental health problems, dementia, types of learning disabilities in detail. If we talk about causes of mental health issues generally, then there are the biological factors that can contribute towards it. In biological components, it could relate to genes and hereditary. Then there are psychological factors, normal stressors, and the other overlapping disorders can lead to the different issues. Environment, in environment there are a lot of the things like your workplace, the people around you, the way you're living, so all constitutes of your environment. So the different environmental factors can lead to the issues as well. Then the socio cultural factors also leads to the mental health problem. For example, peer, in our social circle there are a lot of the people like our peers, relatives, families. So conflicts arising from these social circles and from the culture, like new acculturation, adapting to the new cultures. So these issues can create the mental health problems, and along with that, substance use, drinking, smoking, using the different types of the drugs can cause the mental health issues as well. And there are other lifestyle factors, socioeconomic status, and a lot many things which we can discuss in detail, that these all factors somehow can lead towards a mental health problem. So it is very important to be aware of the different factors that can affect or that can cause the mental health issues. Types. First of all, we'll discuss, as it's our main topic, to discuss dementia and learning disabilities. So dementia is basically a broader term that is associated with loss of memory and overthinking abilities, and that are very severe enough to interfere with our daily life activities, which means that memory loss and overthinking is too much that we are not able to do our daily life activities. Dementia is of many types, which we are going to discuss in later slides. Um, Overall, um, if we talk about the signs and symptoms of dementia, it can cover many conditions but cause a significant decline in memory, thinking, reasoning, and communicating. Other signs of dementia include short-term memory, keeping track of person wallet, for example, paying bills, planning and preparing meals, remembering appointments, traveling out of the neighbor. So these are few of the examples of the signs and symptoms of dementia. But dementia symptoms are progressive, which means the signs of the cognitive impairment start out slowly and gradually get worse over the time, leading towards the dementia. Cause other than well, first we discuss generally what are the causes of mental health issues. Now if we talk about the cause of dementia, dementia is basically caused because of the damage to the brain cells, and this damage basically affects the ability of brain cells to communicate with each other. When brain cells are damaged, they won't be able to communicate with each other, and these brain cells, when brain cells cannot communicate normally, thinking, behavior, and feelings could be affected. As we know that our brain is having a different regions, each of which is responsible for different functions. For example, one area might be responsible for memory, the other one judgment, other one movement, language processing, thinking. So each region of the brain is associated with some type of a function. When cells in the particular region of the brain are damaged, the region cannot carry out its function normally. Different types of dementia are associated with different types of cells damage in particular regions of the brain. For example, in Alzheimer's, high level of certain protein built up, and it's make it hard for the brain cells to stay healthy and to communicate with each other. And the brain region where this happens is called hippocampus, which is our center for learning and memory. So that's why memory loss is often one of the earliest symptoms of Alzheimer's. Well, let's discuss one by one the types of dementia. First of all, Alzheimer's, which you might have heard. Alzheimer's is most common form of the dementia. It is caused by when there is abnormal build-up of the protein, leading to the cells damage and brain starts shrinking. So, which area is actually damaged and which brain cells are damaged in which of the area of the brain is basically called hippocampus. Hippocampus is the region of the brain which is responsible for memory, and if it is affected, obviously is affected early, and it is followed by cerebral cortex as well. If it is affected, the issues like memory loss, confusion, and disorientation occurs. Difficulty finding the words and understanding the speech also appears. There is an impairment of reasoning and decision making, and also changes in mood and personality. The next type of the dementia is called vascular dementia. This is basically caused by reduced blood flow to the brain due to the stroke, mini strokes, or the blood vessels damage, leading to the brain cell death. Now, the location of vascular dementia determines the symptoms, but it is most commonly affected areas include frontal lobe. As you can see in the screen, our brain is having the four lobes: frontal lobe, parietal lobe, occipital lobe, and temporal lobe. The frontal lobe that is responsible for executive function like thinking, planning, organizing, problem solving, emotions, and behavior control and personality. So and subcortical areas include sensory cortex and motor cortex. Okay, so one is motor, obviously it is responsible for movement, and sensory is responsible for sensations. So in vascular dementia, the blood flow to these is affected. Because of that, there is a cell damage, so to the frontal lobe and to the sensory cortex. It means frontal lobe, motor cortex, and sensory cortex. So these are affected. So when these are affected, so this type of dementia can cause an issues with problem solving and planning, slower thinking and reduced concentration, trouble with organization and decision making, mood changes, depression and empathy, possible movement issues as well. Next type of dementia is called Lewy body dementia. This is caused by buildup of abnormal protein deposits, which are called Lewy bodies in brain, and it affects cognition, movement, and sleep. The regions which are affected in Lewy body dementia are cerebral cortex, basal ganglia, and brain stem. Each of this brain region is responsible for, is having its own function. For example, cerebral cortex is associated with cognition, basal ganglia with movement, and brain stem with sleep regulation. So, if a person is diagnosed with Lewy body dementia, the issues with fluctuating alertness and confusion, you can see them. Visual hallucinations occur, difficulty with focus and attention appears, Parkinson's symptoms that are tremors, stiffness, and slow movements, sleep disturbance, acting out dreams, excessive daytime sleepiness can also occur. So after this, there is a frontotemporal dementia. It is a rare type of dementia. It is caused by degeneration of frontal and temporal lobes. It affects personality, behavior, and language. So the brain regions, as you can see from the definition, which are affected are frontal and temporal lobe. Frontal lobe, which is involved in the executive function like behavior and reasoning. Temporal, language and emotions, both of them are affected. If they are affected, they can cause any issues in personality and behavioral change, impulsivity and lack of social awareness, difficulty with language, compulsive and repetitive behaviors, and emotional blunting as well. There's another type of dementia as well, Huntington disease dementia. This is type of a genetic disorder causing a progressive brain cell damage leading to cognitive, movement, and psychiatric system. Now, in this type of dementia, the brain regions which are affected are called basal ganglia and cerebral cortex. Cerebral cortex is responsible for cognition, cognitive functions, which is thinking, memory, decision making, problem solving. And the basal ganglia is responsible for movement. Issues related when a person is diagnosed with Huntington disease, the issues related to uncontrolled movement occur, difficulties with focusing, planning, and organization appears, emotional instability is there, impulsive behaviors, and speech and swallowing difficulties also appear. So we have discussed the types of dementia. Now how we can support the people with dementia. Sadly, there is no cure, but we can support the people, individuals who are suffering from these type of conditions. Um, for example, um, we can support them like for example, we can give them a sticky notes, regularly monitoring them, because the people living with the dementia are likely to experience the feeling of illness, and they have the negative experience of living. So we can support them in a different ways, setting a reminders for them, checking them. Being competent enough to communicate with them. We should know about the verbal and non-verbal cues so that we can communicate with them effectively. We should be aware of the signs and symptoms as well. We should review the care plans and the history of the patient so that we are aware, because patients might have memory issues, so they might not be able to communicate with you properly or what are their needs and preferences, but by reviewing the care plan we can have a look over that. So these are the little steps which we can take to support the people with dementia. Now, learning disabilities. Learning disabilities are neurological disorders that can affect a person's ability to acquire, process, and use information. There are different types of learning disabilities associated with reading, writing, maths, reasoning, and even social. So, we are going to discuss them in detail. The causes of learning disabilities could be complications during the birth, genetic conditions, any injuries in the childhood, understanding information, learning new skills, difficulties in communicating, and living independently. How we can support a person with learning disabilities? Obviously, every individual is having a different needs, preferences, life history, and experiences. The provided support must be person-centered to meet the specific needs of the individuals, and it should develop and enable them to develop their skills and become more independent. Types of learnings. Disabilities, first of all, is called dyslexia, that is a reading difficulty. It affects a person's ability to read, write, and spell. The affected region is left hemisphere of the brain, which is responsible for language and decoding the words. Issues or difficulties recognizing the letters and the sounds appear, slow and inaccurate reading is there, trouble with spelling and writing, comprehension, struggling with reading comprehension, and mixing up the similar looking letters like B and D. Dyscalculia, which is maths disability, it affects an individual's ability to understand numbers, mathematical concepts, and calculation. The region that is affected is called parietal lobe, which is actually responsible for numerical processing, logical reasoning. So the person will be having a troubles with basic arithmetics like addition, subtraction, multiplication, and division. Struggles with counting and recognizing patterns. Difficulty estimating time, distance, and money. Problems with remembering and mathematical formulas. Next type of learning disability is dysgraphia, that is writing disability. A person who is affected by this, it is hard for them to form the letters, organize thoughts on the paper, and use proper grammar and spacing. So the affected region in the brain is motor cortex and language processing areas in brain. Issues appear like poor handwriting, difficulty in organizing thoughts while writing, trouble with grammar, punctuation, sentence structure, discomfort when writing for longer periods, slow writing speed, and difficulty copying the text as well. Next is auditory processing disorder. That is a condition where brain has difficulty processing and interpreting the sounds. The region of the brain which is affected is called auditory cortex because it is a pathway responsible for processing the sounds. So the person is having a difficulty in understanding spoken instructions, struggles with distinguishing similar sound words, trouble with conversations, especially in noisy environments, poor listening comprehension, difficulty recalling verbal information, and delayed response when spoken to. Then another one is language processing disorder. In this, a person is finding it difficult to understand and compress the ideas. The brain region which is affected is left hemisphere and Broca's and Wernicke's area, which are responsible for speech and language comprehension. Issues like understanding complex sentences and instructions appear. They find trouble finding the right words when speaking and writing. The individual struggle with the grammar and sentence structure as well. Poor reading comprehension, verbal expression, and frequent misunderstandings in conversation as well. So now we have discussed few of the learning disabilities. So there are different ways to support the people with mental health problems. So how we are going to support them? By providing them emotional support, offering a listening ear, active listening, empathy, and reassurance. We should encourage the open communication so that they feel safe and to express their feelings. We should promote the independence by helping individuals build confidence and help self-care skills. By providing the practical assistance, we can help them as well, supporting them with the daily tasks, facilitating access to professional help, educating and raising awareness of the different mental health conditions and coping strategies. We can also support the people by encouraging social inclusion, that is basically supporting participation in community activities and reducing the isolation of the individuals, monitoring and assessing the well-being of the individual, advocating the rights and needs, ensuring that they receive proper care, benefits, and legal protection, promoting the healthy lifestyles by encouraging good nutrition, exercise, and sleep habits. So as we have seen that we have discussed dementia, types of dementia, how we can support them, how we can support the people with mental health issues generally, and we have discussed the different types of learning disabilities as well. Thank you so much for listening.